Okay, so we're going to go ahead and get started, and I think more people are going to filter in the next couple of minutes, but we'll catch them up on what they missed. So, hey everybody, my name is Matt Wellington. I'm the Public Health Campaigns Director for U.S. Park Education Fund, one of your co-hosts for this event, and I'm also your moderator for today's discussion. So first off, thanks to our other co-hosts, Known and Grown, for helping us put this event together, and also to our amazing panelists, who I'm going to introduce shortly. I think this will be a great discussion. We've got folks that have a lot of different perspectives on the issue of antibiotic resistance. We have human health professionals, we have leaders in the food industry. So this will be, I think, a really lively discussion to have. So let me go ahead and just set the stage for our discussion today, and then I'm going to pass it and introduce our panelists. And then we'll go ahead and have opening statements from each of them, and we'll jump into a Q&A and have plenty of time for that audience Q&A discussion. So antibiotic resistance is, of course, one of the greatest health threats that we're facing in the United States and globally. It's an issue that is near and dear to me after having two close family members struggle with drug-resistant infections, and it's an experience that no one should ever have to deal with. And the World Health Organization just recently said that in order to truly address antibiotic resistance and keep these drugs effective for the future, everybody in any sector using antibiotics has to work together. And that includes human healthcare, that includes animal agriculture where these drugs are being used, because antibiotic overuse in any setting contributes to the problem. So I think this panel really represents what the World Health Organization is calling for. Again, we've got leaders in healthcare, we've got leaders in food working together on this. And I do want to say that we certainly encourage antibiotic stewardship in human healthcare, and we'll touch on that in this discussion as well. But we're going to mostly talk about how we can reduce antibiotic use in meat production, and that's because that's where roughly 2/3 of the medically important antibiotics sold in the US go each year. So without further ado, let me quickly introduce each of our panelists, and then I'll ask that they can give more of their own background and perspective on this issue in their opening statements. So we've got Dr. Jim Rhodes joining us. He has completed his Doctorate of Pharmacy degree at the University of Florida and a Master of Science in Clinical Investigations at Northwestern University. He's currently an associate professor at Midwestern University, where he serves as a clinical and didactic instructor in infectious disease therapeutics and clinical pharmacokinetics, which I think I have just pronounced correctly, but you can tell me if I'm wrong. We also have Dr. Gail Hanson joining us. Gail Hanson is a veterinary public health consultant who works nationally and internationally on public health policy and One Health issues through her own consulting business. She has worked at the Pew Charitable Trust on Capitol Hill as an epidemiologist at state and local levels and in private veterinary practice. And I've worked with Gail for several years now, so I'm really happy to have her with us. We also have Chris Kovac joining us. Chris is the founder of Riverwatch Beef, which is a grass-fed beef producer and retailer, I believe based out of Kansas. And for the last 15 years, his family has focused on raising all natural free-range beef with no added hormones, unnecessary antibiotics, or GMOs. And of course, we're going to hone in on what that unnecessary antibiotics means to hit him in his practice. And then last but certainly not least, we've got Chef Mary Sue Milliken, who's a James Beard and Julia Child Award-winning chef, best known for her modern Mexican border grill restaurants in Los Angeles and Las Vegas, as well as several other restaurants that she created with her business partner, Susan Feniger. Mary Sue has co-authored 5 cookbooks, co-starred in Food Network's Too Hot Tamales, which I have not seen, but now I really, really want to, and also successfully competed on Bravo's Top Chef Masters. So with that, I'm going to pass it to our first panelist to give his perspective on working on this issue as an infectious disease clinician. And I'll just ask that panelists keep it to a few minutes in your opening statements. So Dr. Rhodes, over to you.
Well, thank you very much, Matt, for that kind introduction. Hopefully you can hear me okay. But I wanted to just give some brief background and say that I'm excited to be part of this conversation today. I agree with your opening statement that antibiotic resistance is hugely important, and it spans not just human healthcare, but also the entire sort of gamut from animals to humans and to the environment. And so in terms of brief background, I think you did a nice job of sort of summarizing my education. And I went to the University of Florida. PharmD degree is a doctoral degree. It's a 4-year program in addition to sort of your undergraduate classes. I also did clinical residency training, which is something that is optional. It's not required, but it is highly recommended for those who participate in patient care activities in the hospital setting and in many other settings. I also did sort of specialty residency, similar to many physicians. So we specialize and did a subsequent fellowship in infectious diseases. So what I focus on in terms of my infectious diseases research is the interface of antibiotic exposure. So what happens when we give people our doses and what happens to the outcomes of the patient. Because sometimes with these antibiotic resistant infections, it's very, very difficult to treat them with standard or conventional doses. The doses that are sort of gone through the FDA process and developed by the manufacturer, unfortunately just don't work under a lot of circumstances. And the patients that we see in the hospital are very medically complex. They have altered physiology, and they're not really sort of your garden variety cellulitis or UTI. Unfortunately, this is some of the most incredible life-threatening infections that you can imagine. And so under those circumstances, those are the patients that I sort of see routinely in the hospital setting. And when I think about antibiotic resistance, we sort of have a technical definition. I think of antibiotic resistance that we use in the lab, and we can measure the resistance of a bacteria to an antibiotic. But there's also sort of a conventional or what I would say more simplified version of resistance, and that is the antibiotics that we use don't work as well today as they did yesterday and as well as they did the day before. And so the more that we use, unfortunately, these incredibly valuable resources, the less effective they become. And that means that we want to minimize the overuse of these agents in human healthcare, but I think across the healthcare spectrum and across our entire ecology. And so we sort of see that antibiotic resistance as a problem. Sort of some people have called it a silent pandemic. I kind of think about it as almost sharing many parallels with the climate crisis. We don't often see sort of the impact of antibiotic resistance until it's really, really dire and it's sort of in our faces, you know, our loved ones or ourselves in healthcare setting. And then it has a really dramatic impact. And so again, you know, like you alluded to earlier, our loved ones may get an infection, something as simple as a UTI, and the antibiotics that worked yesterday, the day before, a year ago, no longer work. And that means maybe longer times in the hospital, maybe a longer length of stay, more complications. Maybe they have to go home with IV antibiotics instead of oral antibiotics. All these things add up. And obviously the worst case scenario is that it's an infection that you don't survive. So it really has huge importance for medical care of patients, but it also, I think, has importance for animals. It has importance for all of us. So it's sort of a global problem, but I'm excited to have a conversation today about what steps can be taken sort of day by day. So that's sort of my background. Thank you so much.
Thanks, Dr. Rhodes. Yeah, definitely have a couple follow-up questions once we get to the Q&A for you. And I often think, like, if you really want to jolt people's attention on this, talk about antibiotic resistant gonorrhea, right? I mean, we could be looking at a point where infections like gonorrhea are no longer treatable, but we're not going to talk much about that in this discussion. So let me pass it over to Dr. Hanson to talk about agriculture's role in this.
Hi, yeah, thanks, Matt. And you did a nice introduction. I'm a public health veterinarian. I've been in private veterinary practice. I've been in public health and policy at from the local, state, national, international levels. And yeah, I worked for a US Senator for a while. I've been working on antibiotic resistance issues pretty steadily for over 15 years. Antibiotics are used in food animals for treating sick animals and controlling outbreaks, as you might expect. But antibiotics are also used for animals in large quantities for what's called prevention. That means giving antibiotics in levels too low to be expected to kill the bacteria and give those to animals that aren't sick or even exposed to disease, but rather to sort of compensate for bad management practices. It grew out of the USDA policy of the 1980s to sort of get big or get out of farming. And it really promoted the idea of treating animals like widgets. So basically, industrial farms try to make the animals conform to sort of massive, quick production of meat and eggs rather than tailoring farming practices to fit the animals. And among other things, that means housing them in crowded conditions, breeding animals, feeding them to encourage faster growth without regard to the animal's natural needs, and feeding them low levels of antibiotics in the name of disease prevention. This profligate use of antibiotics, especially low levels of antibiotics on millions and even billions of animals raised in unnaturally crowded and often unsanitary conditions, and in the absence of disease, sets up a perfect storm for bacteria to become resistant and to thrive and to spread. And remember, bacteria become resistant to antibiotics. People don't, animals don't, it's the bacteria. And the bacteria can freely exchange their resistant genes with other bacteria, even with dead bacteria. They can pick up resistant genes from dead bacteria. So the odds are ever in the bacteria's favor. Resistant bacteria obviously can be a problem for those working directly with animals or eating meat contaminated with bacteria. But bacteria and resistant bacteria also get into the water from runoff, from plants, from manure spread on soil, and in the air as the animals are trucked to slaughter facilities. So as long as you aren't eating, drinking, or breathing, you don't have to worry about resistant bacteria, which means all of us do. We've successfully raised animals for thousands of years without industrializing them, and industrialization of farming was never really a response to a lack of meat. We already produce plenty of meat, and we often take over land that could be used for crops that can be eaten by people, to grow crops that are only used to feed animals. And sort of despite what Big Ag claims, we're not feeding people in low-income countries with the meat we produce. And I'll stop there.
Yeah, lots of good tidbits in there, Dr. Hanson. And once we get to it, I definitely want to talk more about that gene transfer, because you and I spoke about that, and it really, I think, puts this into perspective. But let me pass it to Chris Kovac. And Chris, if you could really hone in on what unnecessary antibiotic use means to you and what Riverwatch beef, what are your practices, that would be great. So over to you, Chris.
Good morning, everyone. I'm excited to join this great panel and talk about an important issue. I'm Chris. I'm the founder of Riverwatch Beef. We are a Kansas grass-fed and grass-finished family beef producer. In other words, doing it the old-fashioned way, the opposite of industrial beef. Our family's been doing it for 15 years. I did not grow up on a farm. I actually came from an office job. And as I started helping my dad, it was his farm or his pasture land, and learning about the different ways of raising, in this case, beef animals, I really developed a passion for it and sold my house actually to fund the business to take us to the end consumer. And so we want to do free range, grass fed. We want to produce beef the old-fashioned way, as I mentioned. And so the reason why is, as we talk to local producers, trying to understand why they're using antibiotics, and it goes back to that preventative. And so why are we doing that? Why are we raising animals in a concentrated animal feed operation, in other words, a feed yard? And so kind of learning from them, and maybe that there's a better way to do it. And by raising animals in the free range, there's less stress. We don't have a need for antibiotics or putting hormone patches or feeding kind of the food waste and other things that go along with grain-fed beef. And so the important thing to us is really consumer education. And it's great to have customers who used to maybe get some beef the old-fashioned way. They used to know a farmer. They used to get a quarter beef or maybe a full beef. But really, we have all of our customers interested in how are you producing your beef? What are you feeding them? How are you finishing them? How are you processing the animals, and so on and so forth? So it's really great from our perspective to see customer demand starting to grow and gain momentum. And so hopefully we can use that to affect change in the industry. We don't have a lot of choices. So the big producers are going to use antibiotics and kind of a whole bunch of unnecessary things. But I think by establishing demand and providing access to better quality beef, I think that we can create a change. And so that's kind of our focus, and we can kind of dive in a little bit deeper when we have the Q&A session.
That's great. Thanks, Chris. I forgot you at Soldier House, putting it all in, putting all your chips on the table. Okay, great. So let's go to Mary Sue Milliken.
Hi, everyone. I'm very excited to be here also. I'm a chef and I've owned my own restaurants for 42 years. About 10 years in, I became a mom, and those maternal instincts got me thinking and looking at what I feed my babies and what I feed my broader audience, my customers. And I learned about the overuse of antibiotics through Super Moms Against Superbugs, which was a Pew program. And that was in 2012. And I was basically horrified at the prospect of a superbug disaster brewing. And I decided, I can't be part of this system that supports the overuse of antibiotics. And so I found new sources for all of our animal products. And while it's not impossible, it takes time. And in my industry, in any industry, time is money, and it also costs a bit more. But my business partner and I, we just felt so strongly, even though we got some pushback from our chefs and our team, they're all held accountable for the bottom line, and they're bonused based on, achieving certain goals of food cost and benchmarks. So, it definitely is something that affects businesses, but it can be done. It actually, I think in some ways, my team is very committed to working for me because of the kinds of decisions we make about sourcing things that are better for our health and better for the planet. We do a lot of sustainable sourcing of really everything we try to. But there are some things that, like certain sausages or smoked products that are really hard to get that are raised without antibiotics. So that becomes a bit of a challenge. But I think, we try to, really get our customers involved, and it also brings some loyalty from our customer base. And even though, when you're out having a wonderful meal with family and friends, it's really not the setting where you want to learn about the dangers of antibiotic overuse in your food system, kind of puts a downer on the whole meal. But still, I think chefs are kind of, listened to and can be really effective in this conversation. Just for example, we sent a newsletter out on Monday about this panel, and this webinar link got over 200 clicks to register after it went out to our community. And actually, that's more than clicked on the meal kit that we're selling next weekend, which is interesting to me. I was actually shocked when our marketing manager let me know that yesterday. So I'm really committed to this cause. It's the right thing to do. I care about the world we're leaving to our grandchildren, but also my husband 3 or 4 years ago got a MRSA infection in his foot, and it took about a year and 2 hospitalizations, and he actually lost a bone in his baby toe. So this is a real thing that happens to a lot of us. And so I'm excited to have this conversation and to, impact change.
Thanks, Mary Sue. Yeah, I was shocked when you told me about your husband, because it's an almost parallel story to my wife, who had a MRSA infection in her toe. So yeah, and I think it is surprising to me when people, really just sit down and think about it. They know someone who's had a drug-resistant infection. And I guess that does get to my first question for Dr. Rhodes to kick off the Q&A here is, for you in clinical practice, how has this issue evolved over the last 5-10 years? Like, what are you seeing with your own patients? Does it seem like it's getting, well, I'll let you answer. How has this evolved over the last 5 or 10 years?
Oh, that's a great question. I'll try to give, I think, maybe a population level view. And what I mean by that is, what are we seeing with a lot of our antibiotics, even in the hospital setting? We trend, right, our antibiotic susceptibility within our own facility. Every hospital just about that does their antibiotic testing trends this. we look to see our trends of antibiotic resistance. Are some of our first line antibiotics stable? Are they doing better? Are they doing worse? So we look at that and we sort of see, okay, how is the susceptibility or the activity of our antibiotics holding over time? And what we're seeing is because standard organizations that look at, what our antibiotics should be doing, how well they should be working, what they're doing is they're saying, you really do need to change some of your standards for susceptibility. And what that means is these are organizations like the Clinical Laboratory Standards Institute, so standard setting organizations. What that means is that the susceptibility of our antibiotics are going to be decreasing because, again, the activity of these drugs are not quite as good. And so examples that we see are that we have to use higher doses. We have to be more aggressive. We have to be more creative in terms of the dosing that we use for our patients. We have to use, restrictions. So we place these restrictions around antibiotics. And when a new antibiotic comes on the market, it takes billions of dollars, right, to bring antibiotics onto the market for one new human use antibiotic. But we tightly restrict these because we're afraid that resistance will be, develop fairly quickly. And we know that it will happen. We've seen that even with some of the most recently approved antibiotics. We've got some cases that we'll be talking about in the literature soon of antibiotic resistance to some of these new last line antibiotics. So the population view is we're looking at our numbers. I think all hospitals are looking at their numbers, and they see that our first line antibiotics are becoming less and less effective. We're having to use higher doses, and we're having to look at these last line agents and seeing even resistance to those. So I think the bottom line is that for as long as we need our antibiotics, which we will, I think, as long as humans get infections, there's going to be a resistance problem. And so that's sort of the pressure that we can't, I think, change. But what we maybe can change is some of the other pressure on resistance that is unnecessary. So that's sort of my view of the high level take on antibiotic resistance in humans.
Yeah, and you had mentioned developing new antibiotics takes billions of dollars. And I'll just say the antibiotic pipeline right now is minimal, right? There are so few antibiotics being developed. And so we often say, yes, we need new antibiotics, but we really need to stop overusing the ones that we already have. And then just to your point about trying to be so careful with antibiotic use in the hospital, what's your reaction to what Dr. Hanson had said earlier about the widespread preventative use of drugs in low doses in many cases on animals to prevent disease? What's your reaction to that as a clinical practitioner?
Well, certainly it's somewhat disheartening to sort of hear that these resources, right? You think about an antibiotic, the ones that we use in animals and the ones that we use in humans are very, very similar. And so the resistance that can develop in bacteria crosses over from animals and humans. And there are definitely documented cases of antibiotic resistance, UTIs that are very similar to the types of resistance that we see in animals. And so I'm discouraged in a lot of ways by that, but I guess I take heart in the fact that there is an acknowledgement that this is a huge problem and that we're having this conversation today about, again, what can be done, on the local level, on a small level, but maybe even on a larger scale to address that concern, because we have to use these antibiotics in patients, right?
Right.
Very often they're very sick in the hospital. Some of them basically have non-functional, dysfunctional immune systems, and so they're relying on these antibiotics to keep them alive. And if we sort of, in one big area, agriculture, overuse these antibiotics, and someone gets a resistant infection and they have no immune system, that's very, very bad. And
Right.
so I think it's an important conversation that we need to be having.
I'll just note for the audience, if you have questions, you can start to put them in the Q&A function, and I'll start to weave those into the discussion here. So I definitely encourage folks to put their questions in the Q&A. So I want to jump over to Dr. Hanson and also Chris on this next question. So, Dr. Rhodes was talking about seeing the profile of antibiotic resistance get worse in humans. how does this issue relate to animal welfare, right? I assume if the drugs aren't working as well in humans, they're probably also not working as well in treating sick animals. So let me start with Dr. Hanson. What do you think about that? How is this an animal welfare issue, the overuse of antibiotics?
Sort of two things, as you mentioned, Matt. First of all, that we are seeing that the antibiotics that we're using in animals are not working as well as they used to in the animals for animal diseases. But like, as I sort of said before, it's the bacteria that become resistant, not the animals or the people. When we're using low levels of antibiotics, and when we're talking about food animals, we raise 9 billion with a B chickens every year. And millions of cattle, millions of pigs, millions of turkeys, probably a billion turkeys now. And we're giving them low levels of antibiotics to many of those animals. Every time you do that, each one of those animals becomes sort of a mixing vessel or a potential petri dish for developing antibiotic resistance. And antibiotic resistance in bacteria that can then spread that antibiotic resistance to other bacteria within that animal, or if it gets into our systems, within us as well. So that's really, that's what makes me a little bit crazy. It's giving low levels of antibiotics that are not given to treat a specific disease, but just to sort of cover for what I'd consider bad management practices, and keeping the animals too close together, that you're trying to solve a problem you've created by making, and in doing that, is one of the unintended consequences is you're developing another problem, which is the antibiotic resistance. And I'll let Chris talk about what his thoughts are on that.
Yeah, excuse my clock in the background chiming away, but yeah, go ahead, Chris.
Animal welfare is obviously important, but I think from a macro producer standpoint, it's about profit, right? And so the preventative aspects from antibiotics from the big four producers, which account for about 80 some odd % of US beef production, they're just trying to squeeze out every dime that they can, regardless of whatever environmental impact or human impact they have, which is unfortunate. These companies are publicly traded companies, and that's what they're going to do. On the flip side of that, from a small producer perspective, it's financial as well. So again, we don't use antibiotics unless an animal has a life-threatening illness, which is pretty much never. I think that's happened maybe a couple times in the last 5 years or so. But from the small family producers that are our neighbors and friends, they all have second jobs. In other words, there's not enough, they can't produce enough income to pay all their bills. And so there is a fear there that if one of their animals gets sick, that's going to not only cost a lot of money, there's no way to produce an animal, it's going to take 18 months. So I think from the macro, I'm not sure if that's going to change outside of legislation, perhaps. But on the micro producer side, if there's financial incentives, if we could have case studies or business cases to say, you know what, your yields are going to be the same and perhaps maybe a little bit better in some cases. So I think everyone wants animals to be healthy, but it's that economic aspect that's driving the decisions, at least from a small producer perspective.
So
well, I sort of add that some of the use that's being driven, for these, especially the preventive uses, is more anecdotal than science. Everybody talks about wanting to have science-based, science-based use of antibiotics, but a lot of the antibiotics, and there are studies that show that the preventive use is less useful than the producers think, that they may be they're giving the antibiotics with the thought that it's going to give them that extra dime that they can squeeze out. But there's not a lot of really good data to show that that's actually working for them. So, I think, it's always the sort of more research is needed, but there really hasn't been a lot of research of, is it really making a difference for them? Or is it just making a profit for the drug companies?
And I would add to that, they're doing it the way that it's always been done, in the last couple generations. And when you're out in the field, when you're working 18-hour days, you may not have the luxury of learning new things. So I think that's a great point, Dr. Hanson.
And I would just add that, we got some questions about the system in Europe. And I remember, I'm not completely up to speed on what's happening today, but when I was learning more about it 10 years ago, the pork production in, I think it was Denmark, had basically almost zero cost increase when they completely shut down the overuse of antibiotics. It was like 2 cents a pound or something more. But I think also in Europe, people are used to spending more on their food, and they're not, in America, we have gotten completely comfortable with the artificially low priced food at the cost of our public health. And I don't think, that's something we have to battle against and try to counter. And I do agree that legislation is so important. When I was lobbying, I met with one of my representatives, Henry Waxman, who then about a year after I had met him on the Hill, he did a press conference at my restaurant on this exact issue. And when he walked in the door, he said, whispered in my ear, I'm really sorry, this bill is so watered down, but it's the best I could do. And it was about, I think, self-reporting of ranchers on their antibiotic use. But I'm a little frustrated too. It's been 10 years since I lobbied, and not much has changed. So I think it's going to be a combination of, huge swell of public opinion and pressure, and but it'll come down to legislation eventually, and more expensive food likely, but not by very much if we really look at the counterparts in other parts of the world.
Yeah, I want to stick with that for a second, Mary Sue, because right, we often say we shouldn't be sacrificing our life-saving medicines to produce a slightly cheaper hamburger. So how did you communicate that to customers when you made your switch of sourcing? How did you do that? How did you communicate that potential increase in cost to customers, to your employees? What were those conversations like?
Well, we tried to, it's difficult. It's really difficult. We have to raise our prices a tiny bit. My team is always worried about overpriced food and the perception. We're not one of the restaurants that serves the 1%. We're not the French Laundry or, Spago. We basically, are very affordable. Our check average is between $20 and $30 per person, including margaritas. But we really, we want to serve a large group of people. We want to be accessible to many people. We don't have a really easy way to do that. We have it on our menus. We have it on our website. I get involved in as many things as I can whenever I'm speaking publicly. I talk a lot about all the different kinds of sourcing that is so important to our concept in our restaurant. And I do think it's hard to measure. Like, I don't know how, I was shocked that 200 people, were interested in this panel. And I don't know how to measure it exactly. It's more just anecdotal.
Yeah. We've been working on this issue for several years, and it does click for people, even if they don't immediately understand the connection between antibiotic use on farms and their health. It's like, what, we're using antibiotics in that way? What? So let me pass it to Dr. Hanson, because we did get a question about global antibiotic use, and as Mary Sue pointed out, about Europe. So we had an audience member say Europe has taken a much stricter approach to limiting antibiotic use in food production, notably much stricter than the US. Do you see the FDA taking such steps to limit antibiotic use in food producing animals? So Dr. Hanson, can you describe what Europe has done, and I guess talk a little bit about what's the FDA done recently or not done recently, and what you think the direction is going to be moving forward?
So it pretty much started in the Scandinavian countries, where they first said antibiotics should not be used for growth promotion, because in the US until 2017, not only were they using it for prevention where there's no disease, but they were using very low levels to get animals to grow faster, which actually the research showed that it didn't work that well doing that with in the last 20 years or so. But in Europe, they said you can't use it for growth promotion, and antibiotics have to have a veterinarian prescribe them. And there's an accountability, and we have targets for trying to reduce the use. Right, so there's sort of a really multi-pronged approach. That was back in the early 2000s, even earlier than that in some of the Scandinavian countries. But in 2003 was sort of when the EU said, yeah, we gotta get a handle on this. In the US, like I said, it was not until 2017 that antibiotics were not allowed to be used for growth promotion, at least the stated use couldn't be for growth promotion. Since then, FDA is working towards getting all antibiotics under veterinary supervision in the US. They haven't done that yet, which amazes most of the people in Europe. It's like, what? You can go pick up some of these antibiotics in the store? Yes. Not to be put in, if it's put in food and water, in theory, it should only be available by veterinary prescription, but there are still other antibiotics by injection, intramural. There's other ways to get the antibiotics in that don't need veterinary prescription yet. FDA is slow. And as they get more pressure to do that, if they get pressure from people saying, look, why aren't we doing this the way Europe is? We are an industrialized country. They're industrialized countries. They figured out how to do this. They aren't seeing any more illness in their animals than we are. They're seeing a decrease in antibiotic resistance that we would like to emulate. But without them getting some kind of pressure, both from Congress and the public, they can continue this very slow law.
Right. Yeah, Mary Sue, you're going to jump in?
Well, I was just going to say there's also the issue of policing it and, the inspectors that, is expensive. And I know just even for health inspectors that come to my kitchens, it's not easy to, that's a whole nother level that will have to happen eventually. And I'm sure happens in Europe, but it's definitely worth it.
Right. So yes, echoing Gail, the FDA is really slow. I would say that in my experience too. So yeah, globally, I guess one follow-up question for Gail and anyone else who wants to chime in, what is the picture beyond like the US, the Scandinavian countries you mentioned? How much of an issue is antibiotic overuse in food production in any part of the world? What does that look like? Or is it really that the United States is kind of the epicenter of that?
I don't know if we're the epicenter, but there are many countries in the world that emulate what the US is doing. So if it's like, it's fine to give low levels of antibiotics to animals, it's fine to crowd them together, it's fine to do all these things that most people would find horrific. And you might be able to get in a couple more 1,000 pounds or a couple more 100 kilos of meat into your populace. So there are countries that do look to the US. There are countries that look to the EU and say, whatever the US is doing, I'm not doing. The sort of middle income countries are beginning to follow the US model of using antibiotics for things other than treating sick animals. There's also the problem, we have very little oversight as Mary Sue mentioned, that enforcement is almost non-existent. It's completely non-existent in some countries. And China is just sort of an unknown. The suspicion is that a lot of antibiotics are being used there, but there's less transparency than there is in the US of how much is used. And in the US, it's almost completely opaque.
Was it in China that story that caught all the headlines, the MCR1 gene, did that originate in China? Am I remembering that correctly?
You're remembering that correctly.
Yeah.
So the MCR1 gene, just for those who might be less familiar, it's an antibiotic resistance gene that conferred resistance to one of our antibiotics of last resort, which is called colistin. It's a polymyxin type antibiotic. So we in the hospital, we use it for like the sickest patients that we see. When everything else has failed, we'll call upon this antibiotic because it's still somewhat effective, even though it's terribly toxic. And the resistance was developed in animals, and then subsequently it's been identified in numerous human infections. So the evidence is very strong that animal infections and resistance developed in animals will cross over to humans, sort of given time and opportunity. And so that is really, I think, hugely important. I just want to, I think, reflect for a moment on something that Dr. Hanson was saying, and that is the contrast. It's a huge and stark contrast between the approach to animals and antibiotic dosing, where you're sort of giving these subtherapeutic low doses. And in humans, and the way we develop antibiotics, we try to find the best dose, the most effective dose. We give, extremely high doses sometimes because we're trying to minimize the chances that resistance will sort of be left behind once we're done treating a patient. And it's just a huge night and day difference between those two approaches. And again, I think that really does require, I think, careful attention. What we've done in humans is we bring to bear something called antibiotic stewardship, which is, again, a group of healthcare providers, pharmacists, physicians, nurses, and we look at our antibiotic use both in the inpatient and the outpatient setting. To be accredited, there's CMS, or Centers for Medicare and Medicaid Services, requirements that antibiotic stewardship be a part of healthcare for humans in order to have that sort of reimbursement opportunity. I don't see why, again, in order to sort of be able to bring some of these products to bear and sort of have that stamp of approval, that there shouldn't be some sort of stewardship for antibiotic use in animals. So that's just, again, my 2 cents on that.
I don't see why not either, Dr. Rhodes. Yeah, and go ahead, Chris.
I was just going to say before I forget, and thanks for letting me jump in. I think one of the ways to address international participation is in labeling, as there's a lot of confusion in the marketplace and there's a lot of discussion. Animals that come from other countries can be labeled as product of USA, even though they didn't originate here. But I think extending that to maybe have labeling that clarifies the antibiotic use, clarifies perhaps GMO use, clarifies hormone use, so that people can understand, almost like the nutritional content, that they can understand what is in that animal. But I think unless you have the same rules that apply to everyone, you're going to have people manipulate those. You're going to have a lot of confusion in the marketplace. And even with so-called grass-fed and grass-finished beef, you can call any beef grass-fed if you really wanted to, because the animals are out in the pasture, even though they may be finished on grain. So I think it's creating a new set of rules that we all agree to, and creating new labeling that makes sense.
Let me ask you a question about this, Chris. Like, for producers like Riverwatch Beef, you don't use unnecessary antibiotics, and that's different than saying no antibiotics ever. And to be clear, PERG supports treating sick animals with antibiotics. We've never not supported that. That has always been a core of our position. We want to eliminate disease prevention uses. But you are in kind of a weird position with consumers when you're trying to market that kind of, quote unquote, judicious use, what we consider real judicious use. So how do you talk to consumers about that? Like in your materials and your marketing materials, what do you say so that it's clear to them, no, really, we're only using antibiotics if there's a life-threatening illness in an animal? Because obviously it's easier to just say no antibiotics ever, but it's different. So how do you do that?
We try to be as transparent as possible, both in our blog and within our products. This is how we raise the animal: no antibiotics, no GMOs, and other things that we don't have. But I think that we need to be more clear as to when we do use antibiotics. We haven't used antibiotics in several years, so it hasn't been an issue. But that touched on an idea, and that is the use of technology. It could be QR codes. It could be things like AI. And so effectively, you could understand where that animal came from. In other words, on the packaging, you could have a little QR code. You could scan it to say that animal was in the pasture for 487 days, had 0 antibiotics, this, that, and the other thing. Similar to wine, there's QR codes, and it'll tell you a little bit more about the vineyard. So I think as technology advances and it becomes cheaper to adopt for smaller producers, I think that's where it's going to go, so that you can track that animal back all the way to origin.
I look forward to that time, because I've had the same problem. In the beginning, when we made this shift in our restaurants, it was all about the never ever product, because there was nothing in between really, even though we didn't want, you know, the people we were supporting not to be able to treat real infection when an animal is infected. You know, and if you say never ever, then that means I think you have to sell that sick animal and get them away from the rest of your herd quickly. And I'm sure that's not always possible to detect. And so it's really complex, and we need good labeling. Chris, that's such a good point, because we don't have it and it is confusing. But the other point I just wanted to bring up is that for reasons other than antibiotic overuse, we need to consume less meat, I think, for the climate. And so one of the messages that I'm constantly saying to my team as well as to the public is, you know, create food that a carnivore will love, but use 20% meat and 80% plant-based on the plate. You know, so make the plate really balanced. And I'm not suggesting that everybody be a vegetarian, but I'm just saying that eat more expensive meat that is, you know, grown or ranched with, you know, the right kind of standards. And that's going to be better for your body. It's going to be better for the planet. We have a program where we try to keep our menu at 80-20 between proteins and plant-based food. And I think for so many reasons, for our health and for the health of the planet, it's going to make sense. So that's one of the things I try to really push.
Right. Less meat, better meat. I don't want to open up all of that because there's a whole other discussion on that front, but I did want to address something that came into the Q&A before we forget here. So we had a veterinarian chime in and say there's definitely growing interest in antibiotic stewardship in veterinary medicine, both in the food animal and companion animal sides. And I just want to be clear, I don't consider, I do think veterinarians care about antibiotic stewardship. And when I talk about misuse of antibiotics in meat production, I'm thinking of that as a system that we need to change. I'm not thinking of that as individual veterinarians making bad choices, but I wanted to ask Dr. Hanson about this. What's your take on how antibiotic stewardship has evolved from a veterinarian's perspective, like typical veterinarian dealing with food animals? How do you think it's evolved, and where do you think it can grow?
Well, it certainly has evolved, because I know I had discussions, like I said, I've been doing this for a good 15 years, and actually first heard about this back in the last century before I got into veterinary school, looking at antibiotics as growth promotants back in the 70s, when USDA said, and some, actually not USDA, some senators said, you can't talk about that till we have all the science, like there's such a thing as all the science. So veterinarians, I think veterinarians have always, you know, we're committed to animal health and public health. I can tell you 15 years ago, there was a different attitude in the AVMA, the American Veterinary Medical Association, and some veterinarians about the use of antibiotics. It was like, yeah, we know what we're doing, leave us alone, don't bother us. And I think I have seen a shift to recognizing stewardship. My sort of, from my own personal observation, it really started a lot in the universities, the veterinary schools, and is slowly moving into private practices, and ultimately we'll get into the, I would like to think we'll get into the larger production groups. You know, there's sort of 4 big groups that produce most of the meat and poultry that we have in this country, and they have their own veterinarians, they have their own standards. Those changes, you know, they're not going to change unless they can see an economic reason to change what they're doing. So once again, as consumers are asking for better stewardship, the stewardship will come. If nobody's asking for it, nobody raised the question, it didn't show up. Now that people are starting to ask that, veterinarians are going, yeah, we should be doing this, we are doing this. I mean, I think about when I was in private practice, that I would give antibiotics to a cat that I knew had a viral infection. I would give them antibiotics just in case they developed a secondary infection. Was that a good idea? No, it was a terrible idea. So we have evolved, but I think we should be looking at what can we be doing to do better? What kind of targets can we set, as they've been setting for human medicine? So you may not reach those targets, things can happen, but if you don't set a target, if you don't know where you're going, you're never going to get there.
Absolutely. And I'm going to ask a question to open it up to all of the panelists to start closing us out. But really quickly, I'm chiming in with other progress in the marketplace. So chicken has been a major success in the last several years on reducing antibiotic use. And I think that's largely been driven by consumer demand, right? We've had major fast food companies who, of course, purchase incredible amounts of meat, say that they're sourcing chicken raised without medically important antibiotics. And I've seen surveys that say 98% of the broiler chicken industry in the US now are not misusing antibiotics according to our standards, which is just incredible. So I think it can happen. Cattle, I think, and pork production is behind on that front. We have seen restaurants make commitments. Unfortunately, they have not actually followed through yet in many cases, McDonald's being the prime example. So more work to do there. But let me ask this question of each panelist. What do you think are the biggest challenges to addressing antibiotic resistance and reducing antibiotic use in agriculture? And how do you think we can overcome them, either from the marketplace strategies, consumer education, whatever that could be, or policies that we need to be putting in place? And I'll start with Mary Sue. How about I start with you?
Well, I think the barriers to fixing this problem, are many, but I think first and foremost, just for the consumer and for the restaurateur or the food service provider, I think being confused all the time about the labeling, about the standards, about exactly what you're buying, about being confident that there are inspectors that are making sure that what you think you're buying is actually what arrives in your back door. I think that we need clarity. We need to really demand that we're able to make those decisions. And I think the average consumer, is just not, we cannot expect the average consumer to really take deep dives into science about every single product that they buy and whether it's good for their bodies or good for the planet or whatever. We have to really make it easy. So the confusion needs to be, eliminated. That's what I would say.
Yeah, absolutely. I'm just running through my head all of the different labels as I stroll through the grocery store, and it even makes my head spin. So Chris, why don't I pass it over to you? You're on mute.
I apologize. I had to restart my Zoom and I missed your question. But I will talk about from a consumer aspect. Was it about the labeling and what can?
No, well, you certainly can jump into that, but it was what are the biggest challenges that you see in addressing this issue, and how do you think we can solve them?
I think there's two challenges. One is an economic challenge. We all know it costs more to produce naturally raised animals, and there's consumer sensitivity to those price increases. And people often ask, well, why is this more expensive? So I don't know if there could be programs to offset some of those costs, but as long as it's more expensive, you're going to have, just from an economic standpoint, people defaulting to the cheaper product. People also view meat, beef in this case, as a commodity. So an animal is an animal is an animal, when in fact that there's a lot of variance there. And I think the second part of that is consumer demand and educating consumers to what questions they should ask, right? So here's the 3 questions that you can ask any farmer's market, local producer, really any company that's selling meat, so that they can educate themselves and so that they're asking the right question, because it's easy to manipulate information and to give people kind of answers that may not be exactly what they're looking for. And I think it's a coalition, right? So I think from the medical industry to agribusiness to influencers to chefs, it's really a community, right? And so I think the more that we have these types of discussions, the more that consumers are involved. Mary Sue, I put this out on my newsletter this morning and had a bunch of clicks. So I think that's great. And I think that momentum will continue, knock on wood.
Yeah, absolutely. Dr. Rhodes, how about you?
Oh, thank you so much. I think I want to reflect on the challenges that we've had in human antibiotic stewardship. And for many years, stewardship is what we did because it's the right thing to do, because we believed in it. We were running uphill, though, right? We didn't have sort of standards. We didn't have CMS standards. We didn't have sort of that mandate within organizations, and that stewardship be required. And the world has changed now that we have the requirement for stewardship. And that is, sort of not truly codified, but it's there, it's in the CMS standards. So I think looking at rulemaking, looking at, either legislation or, sort of federal rulemaking will make a big difference in terms of stewardship for animals. And it's night and day. Once that happens, the incentives are properly structured. You can begin to start to tackle the problem. And I think measurement, right? And that's something that I think Chef Mary Sue was getting at too, measurement and understanding, what is the scope of the problem, understanding exactly what's in that product. So much of science is sort of bedeviled by bad measurement. So we need good measurement.
Absolutely. And so let me pass it to Dr. Hanson.
Yeah, I agree with what's been said, that it really needs to be policy changes, both from producers and government and personal policies, if you will. I think setting targets. There's been a lot of discussion about whether we will pick the right number for a target. We need to pick a target and then sort of see if we're sort of going in the right, whether that's making a difference or not. And then there's a demand not only from individuals demanding something other than the most cheap and most abundant meat that you can get, to sort of thinking bigger, but also, as you've mentioned, sort of the procurers of meat other than individuals. So asking your restaurant, how are you sourcing your meat, and if you don't like the answer, why not? And I realize people have a gazillion things they're doing in their lives that may not be the first thing we think about, but since the people who are watching this are interested in that, ask at your grocery store, ask at your restaurant, where is it, how are you sourcing meat? Are you thinking about antibiotics? If not, why not? If not, I might go someplace else because I have options.
Right. So
there are actually, sorry, the seafood industry has done a fairly good job through the Monterey Bay Aquarium Seafood Watch program, where consumers can have a little business card sized kind of guide in their wallet. And now it's an app on your phone, where consumers, as well as chefs are and purchasers of big amounts of seafood, are really coached and given easy tools to use to make those decisions. And I think that's a really good model for the animal industry to sort of take on.
Yeah, that's a really great example. I'm going to check that out because we've been thinking about those kinds of easy cards people can use. So I'm going to close this out here since we're at the top of the hour, just by saying, I know we've got lots of different people in our audience today. If you're a health professional, if you're a veterinarian, a farmer, rancher, I would definitely encourage you to check out our website for our coalition of stakeholders. It's called preserveantibiotics.org. You can check that out and potentially join up with our efforts. And I just want to thank all of our panelists. This has been a really interesting discussion, and I think it goes to show we're all very much connected between the food we eat and our health, and we can't really escape that. So I think we need to work together to reduce antibiotic use across the board, whether it's in human healthcare or agriculture, because we do not want to live in a world where antibiotics no longer work. And so I will close it out with that. And again, thank you all for joining us, and I hope you all have a good rest of the day. Bye, everybody.